Hello everyone, we have 5 minutes and we will start our, let's say, demonstration. Today we will make just a demonstration. A lot of my colleagues a few days ago started with 8 teeth, talking, making lectures and streaming from their laptops. Today we decided with Evie and 8 teeth to make a demonstration for you. I think it will be nice and funny somehow. You can ask, you can give any question. Leave your question in the comment box and I will answer them all after we finished. I will give you just 5 minutes to start share this video. We want to break all records today. We want to make good views. We want to make good reach today with you. So please, if you love me, share and tag your friends. Previously, I talked about worm vertical compaction and tugback, but in Arabic language. A lot of people asked me to make it in English language, so now 8 teeth gave me the opportunity to be live with you here and to make it in English language this time for my colleagues from all over the world. Share, share, share. I want you to make good shares today. Yes, all questions are welcome. After I finish my demonstration, we will start sharp 3 p.m. Jordan time. Hello everyone. Are you hearing me? Good? Everything is okay? You know, because everybody now sitting home, there's always overload on internet everywhere. Do you have good signal? Okay. We will start now. We'll prepare everything here and we'll start our demonstration now. Okay. Everything is okay, I think, right? You're hearing me well, right? Okay. So, I have this tooth, upper molar. We will work today in the palatal canal. The canal is prepared up to 2506. Okay? So, the issues here, we will talk about worm vertical compaction, but before that, we have to talk about tugback, because a lot of people have a problem with tugback, and they always say, doctor, I put the cone and I checked with the x-ray, everything is okay. After obturation, after I finish everything, I'm taking x-ray and unfortunately I have overextended guttapercha. So, today we will discuss this issue and how I can get 100%, nearly 100% real tugback and good obturation with our worm vertical compaction devices. So, tugback for a lot of people is not a problem. He says, oh, I don't have a problem with tugback because I am always gaining good tugback. But we have to differentiate real tugback from the false tugback. And for that, I'm here now and you see here different sizes of gutta perca. We have here 2504, we have 3004, we have 3504, and we have 4004, okay? And we have here 3006, okay? We will make the demonstration on all these to differentiate the good tugback from the false tugback, or real tugback from the false tugback. After we finish preparation, I want to ask you a question. Are you making the cone fit X-ray with wet canal or with dry canal? I will answer the question. A lot of people making the cone fit with dry canal. So after irrigation, after everything, after preparation, he's drying the canals and he's putting the cone and taking X-ray. That will be not good and not right. I recommend always to keep the canal wet with the irrigant, with the sodium hypochlorite. Why? Because we have a lot of issues here. First one, to mimic that in the canal there is a sealer. So the sodium hypochlorite or the irrigant inside, whatever it is now, will playing a role of tugback, of sealer. That's the first thing. The second thing, to avoid canal contamination, because if you will put cone here and the cone will be extended over the canal and you taking X-ray and pulling it out again, you will contaminate the canal from the periapical tissues area, right? So keeping the canal wet will reduce this problem. So we not ever and never by drying the canal before we gain our tugback and the cone fit in our canal. So let's start with the tugback issues. As I said, here I prepared this canal up to 2506. Okay, some people will say, okay, why you don't bring 2506 cone and put it in the canal and that's it? Okay, but that's wrong. Why? Because not all canals are cylindrical or are tapered. So we don't have ideal canal, right? So we always will have some spaces. For that, if you are using bioceramic sealer, I will not argue with you, because bioceramic sealer is not one vertical compaction, right? But here we are using one vertical compaction, so we have to lean on our gutta perca more than sealer, because different people using different sealers. We are not talking now about bioceramic. We are talking about another sealers, resin-based sealers, zinc oxide original sealers. So we have different sealers. So we have to lean here on our gutta perca. Okay. The other question, why we use always less taper? Because when you are using less taper, I mean less taper from your file, you use taper 6 file or let's say taper 8 file, but we don't recommend high tapered file, of course, to prepare canals. Taper 6 is enough. You want to make sure that the tugback you are gaining it apically, from the apical area, from the apical part of the canal, not from the middle part or from the coronal part. And we will make now live demonstration explaining that. So I told you I have here different gutta perca. I have 2504, 3004, 35, 40, and I have taper 6 too, and I will show you what's will happening here. Okay, I have now 2504 gutta perca cone. I will insert it in the canal. Okay, and I will take X-ray now. Okay, so here it's good. I can't push it more. That's the maximum, but I don't have good tugback here. I don't have tugback at all. Okay? And for that, I recommend you always, when you are preparing the canal with the last file, for example, in our case here, 2506, I recommend you to be very accurate, to be precise, to prepare just to apex and out. So you have to use picking motion. Don't push your file to make over preparation. Over preparation here is dangerous because you will open the foramen here. It will be like open apex, and a lot of your cones will easily go out from the canals. So always, please, when you are using last file in a preparation, always respect your stopper. So a stopper, you put the stopper on, let's say the working length is 22. Respect this 22 millimeters. Don't make it 22.05 or don't make it 22 or 23. Okay? So always respect your last file. So your guttapercha cone will not go so far from the apex. Okay? As you see here, when I prepared this tooth for you, I respected my last file. So I am just kissing and say bye-bye. Do not over prepare your apex. So the 2504 have a have no tugback at all. Okay, I will remove it and I will go to. You will not do that always on your cases, but it's good to understand what's happening here. So after that, I think after this lecture, you will be more precise about tugback and you will change your mind about tugback. I am taking now 3004 with no adaptation of the tip. I didn't cut the tip. I didn't make anything here. And I will insert it. See? The same thing as 2504 to the end. But I have tugback, but I don't like it. I don't like it. But I'm here sure that I am gaining this tugback apically. I'm not gaining it in the middle part or from the coronal part. I am gaining it apically, and I am sure about that. Why? Because I have less taper, and another thing, it goes to the apex like the 25. So two cones goes to the end. Okay, I will remove it, and I will take the 2304, and I will put it here. Okay, I have here now a very strong tugback. I like this tugback. Okay, but what I want to show you now, if I will take 3006 and I will put it in the canal. Oh, see? I have a very strong tugback, But I don't know where is the tugback, from where? From here or from here or from here? I don't know, because it's a very large taper. Okay, what if I will take 40 taper 4? Maybe I will get a better tugback. Let's try together. So I put it here. See? I have very good tugback, but not every tugback means you are in the apex or at the apex, right? So when you are trying different files or different cones, please take your x-ray and be sure from where you are, where's your tugback or where's your cone, it's fit or not fit. So my choice now will be 30 taper 4. Even the canal is prepared 25, because metal does not match cones or does not match guttapercha. Even all guttapercha cones in the same box, they are not even. Okay, so always please, even you, for example, you will drop this down, please take another cone and try it. Okay, because every cone is different. Is everything okay here? Okay, if you have any question, write it down and I will answer all questions after that. So I'm taking the 30 taper 4 with very good tugback. I can feel it now. And I will, 3504. And I feel it now. It's a very strong tugback. Okay, what if I want to modify the tip? I have a lot of, for you, I have a good trick here. If you want to cut the tip here or to modify the tip, you can use a special clipper for modifying the tips. For example, Fanta, they have one, and other companies, they have one. You can cut and modify the tip. Or if you want to cut it customizedly, you can use nail clipper, or if you want to cut it, do not cut it with the regular scissors. Cut it with a blade on the glass slab, because you will have a very fine and very clean cut. So nail clipper, you can to put nail clipper in your clinic just for cones, and you can clip the tip with nail clipper or with blade, sharp blade on glass slab. So you will have a very clean cut. But in my case here, I don't want to modify the tip because I'm very happy with my tugback. Okay, I'll bring now nut sealer. Here I will bring my down pack device. Here we are using down pack device, fast pack from 8 teeth. I will explain you some tips here about these devices, why I like them. Here we can control the temperature. The image here is blinking because it's LED, but I think you can see the 150. I like to put it on the 200 degrees because I want to make the cut quickly and with less time. And you can go up to 250. I do not recommend 250 because it's too high. Okay, so I will put it on in 200. Before starting, you have to make a fitting for your tip in the canal, because you always know, or somebody maybe don't know, that when you want to cut, you have to cut 3 to 5 millimeters away from your working length or from the apex. So you have to fit your fit your fast pack tip just to be sure that it will go 3 to 5 millimeters away, because 8 teeth, they have 3 sizes here, as we can see. They have a small one with black color, they have medium one with yellow color like this one, and they have a blue one, it's the large one with 60, the tip size is 60, the medium, the tip is 50, small, the tip is 40. So you have to make fitting for your tip as much as you're making fitting for your cone. For me, I'm always, or 90% using this tip because it's medium size. I'm very comfortable with it. I can call it universal one. But let's make the fitting together. I will take the smallest one here. I have the black one, the smallest one here. And I will put it in the canal. But it will go too far away. It's about 2 millimeters away. It's very small, so I will take the bigger one, the medium size, and I will make the fit. For me, this fit is very good. See? Here is very good. Of course, I'm not pressing anything here, just making the fitting. So, it's here. I have about 3 millimeters here. It's good for me. With canals with severely curved canals, we will cut just to the curve, or we can use the smaller one, the black one, but we have to be careful with curves, because maybe if you don't have enough experience, you may break the tip in the canal, and you will have to manage that. So for me, the yellow one is good. I will use it. I will set the stopper, because in the real patient, what I see this, I don't see this. I am not working like that. It's just transparent tooth. You can just to demonstrate the situation. Okay, now I will bring this is zinc oxide original sealer, and we will talk about some sealer carrying tips and tricks here, because some people doing like that. They're taking the cone and they're making like that, putting a lot of sealer, I don't know why, and putting it in the canal. That's wrong. This you don't have to do. It's wrong, because we have to have a minimal quantity of sealer, because as I told you, this is not bioceramic sealer. This sealer may be shrink. This sealer may be resorbed somehow. So you have to put the minimum quantity just to make the just to close the space between the cone and the walls as much as you can. So what's the proper way to carry the sealer? I recommend you just to dip it like this, from this side and this, just like that, just dipping. Okay, you are dipping your cone. You are not carrying. Okay, we are not carrying, because if you are carrying the sealer, you will take a lot of amount and you will be messy. The field will be messy. Okay, always when you are working, try to work clean and clear. So do not make that. Do not carry like that. Just dip it like that. Some references, some doctors, big names say I have to see the cone. Okay, I have to see the cone through the sealer. So I'm just dipping my cone and the canal. I have here a dry canal, and I will go and put my sealer inside, my cone inside with the sealer. Okay, and that's it. You can make this motion if you want, in and out motion. You see here some sealer pushed out. This on X-ray will be like buff. Some people like buffs. They always like to make buff here. So the buff will be from the extruded sealer here. Okay, if we will magnify here, we will see the following. We will see that the cone is up here, and this 0.05 or 0.3 millimeters here, it's filled with sealer. Is that good? Of course it's good, because first, this is about 22x magnification, and you have here 0.5 millimeters filled with sealer. Is that healthy? Of course it's healthy. It's not a problem. The problem is when you have shortage above 0.7 or above 1 millimeter. So you have to make recalculations. You have to recapitulate. You have to check patency. You have to irrigate. You have to irrigate more, and then to make the fit. So for us, this is acceptable. Now we will go and cut it out. As I told you, I make the fit. I will cut over here. I'm switching it on 200 degrees. What I like the most here, look, this is the activation button here. All this ring is button, okay? If you are pressing here, pressing here, pressing here, pressing here, all doing the same function, you will activate the tip, and the tip will increase the temperature and quickly, very quickly. See, look here, when I'm pressing, in less than one second, the tip will be ready to cut with 200 degrees. Of course, the temperature here will be not 200, it's less, but we are setting it here 200 to make sure that we have enough temperature here to cut. Okay, so I will put my fast pack tip here beside the cone. Some people, what they are doing, they are first cutting this here and making the packing motion. So they are making two steps technique. I don't like two steps technique in the one vertical compaction, especially in cone cutting. I'm always recommend to do it one step, like I will do here. So I will go out with my zoom. I will put it here. I'm not pressing yet. Well, I will just show you something very interesting here. Not all companies have this function. If you're pressing and you forget the time, you know, we don't have that sense about time. Sometimes 1 minute for us, it's like 1 second. So here, if you will start, here you have a counter here. 1, 2, 3, 4, 5. After 5 seconds, the device will disconnect it. You will not have here any efficiency, because automatically the device will cut the temperature. Why? To be safe of overheating the periodontal ligaments, because our patients are anesthetized. You will make over temperature here, you will make overheat here, and you will damage the periodontal ligaments. So this function is very nice. This counter is very nice. So you know that if you will exceed 5 seconds, the recommended time to cutting, the device will do it on your behalf. Okay, so I will put the tip here, and I will activate, and I will go down in less than 5 seconds. Let's see. Here, I will stop. Okay, I reach the stopper. I will stop. Okay, I will wait for like 5 seconds, and here I'm removing my finger. I'm not doing anything. I'm giving it time to cool down. Now it's cool. I can go out, but I will not go out with cold tip. I have to activate and go out. See? The gutta perca will go out like this because the rest is left here in the canal. Okay, I remove and I bring my spreader, and I will condensate my gutta perca, or you can use this tip with button off. Do not switch it on, and I will magnify here and will show you what I'm doing. My gutta perca is not up to here. No, it's up to here. But this on the walls, so I have to compact it or even cut it if it's too much. See? I'm compacting my gutta perca with plugger, with cold plugger. No heat here, unless I want this heat. If I don't want this heat, I will not. If I don't want this gutta perca, I can cut it out. I removed some gutta perca, and I am here condensating. I'm taking from the walls. See, I'm taking from the walls, collecting the gutta perca from all the walls, and going down. So I don't have now any guttaperca on the walls. All guttaperca are vertically compacted. Okay? Here I have about 5 millimeters filled. About 5 millimeters. That's not bad, it's good. Can you see here my sealer? Here, you see. Why we call it we call it uh, 3D obturation? Because it's filling the canal in 3D ways. Okay, now after that I want to fill back my canal or the tooth canal with warm guttaperca. But before that, you have two choices. Some people recommend you to put sealer here, and some people no. They are go directly and they are filling the canal without putting any sealer. But for me, I always like to put some sealer inside the canal to make sure that my warm guttaperca will adhere to the walls here. Okay. I recommend not to use guttaperca cone for that purpose. I recommend to use paper point, not guttaperca. But in this time I always use guttaperca. I'm carrying some sealer, I'm putting it in the canal, and I make this motion. I will make this motion, just not too much. Do not take too much sealer, because as I told you, be always clean when you are always working. Be clean. So you can see my chamfer here, tooth chamfer here, is not messy. Some people working and they cannot even see the other canals because of the sealer. So always be patient and be clean. Okay. Now I will bring my second device here from my teeth. It's fast fill. I will talk about this amazing device and why I like it. I like this device first because I'm using always microscope. For that, I have always to have ergonomic devices, and this device is very ergonomic. Why? Because it's not gun-like. It's not gun. I don't have to put my pressure to squeeze the guttaperca. Here inside we have motorized. This device is motorized, so the guttaperca will go out automatically, not mechanically. Okay. Okay, I will switch it on, and I will choose 200 degrees to heat the guttaperca up to 200. And I have here, you can see the percentage of guttaperca inside. So the device will tell you if you have enough guttaperca inside. The guttaperca here, what I like the most here, that guttaperca, it comes in bar form. I will show you now. The guttaperca. It's guttaperca bars, as you see here. So you don't have to pay a lot of money to buy extra tips like in other devices. They have their own tips, and the tips are very expensive. So you just taking this bars and putting inside here. You open this out and put the bar here. But fortunately here we have good guttaperca. Every bar like this, it's enough for like 3 molars, 3 to 4 molars. let's say 10 to 12 canals, and that's fair enough. Okay, so the device now, it's not heated yet, it's cold, so let's heat it up. We press here in this button, and the device in less than 30 seconds will reach the temperature that I requested. So in less than 30 seconds, we will reach 200 degrees. I recommend high temperature because I want to, it's easy to manipulate when you have a very warm gutta perca. It's easy to condensate and manipulate. So we are waiting, we are waiting. Now we have 200 degrees and you can work. Here we have blue light will be illuminated and the tip is ready to give you gutta perca. When you are pressing here, you have to press continuously, and the motor inside will push out the gutta perca equally and with good speed. Plus you can here, you can put or you can set up your favorable speed. You want tip to give you the speed, the gutta perca quickly or medium or very fast. So I'm always using the middle option. I want my gutta perca to come out not too quickly. So I will magnify here for you. I will put the tip until I reach my gutta perca here, and I will press the button. I will magnify for you more to be okay. I will press. I recommend here not to fill the canal one shot. I recommend you to fill it incrementally. For example, 2 millimeters and then another 2 millimeters, another 2 millimeters. In this case, you will not have pores inside or bubbles. You will have less bubbles. You will have good, very nice obturated canal. So let's go. Enough. I will stop. I will go out. I will take my spreader and I will push the gutta perca inside. In this case, when you will take X-ray, you will have a very good dense gutta perca. Then I will take it again and I'm putting another 1 millimeter or 2 millimeters, enough. I will go and I will condensate. Some people here, they are stopping. They don't fill the canal more. But for me, I will fill it more just to show you more how we're using this amazing device. The last layer, I will show you how I'm condensating it occlusally. We have occlusal view here. See? If you want to remove gutta perca from here more, if it's attached and it's a large quantity, you can remove it with the fast pack. But in my case here, I don't want to remove anything. For me, it's fair enough. Okay. Because I finished, before I finish my demonstration, I just want to give you a nice trick. I want to give you a nice trick. How I'm cleaning the chamber after I finish my obturation. I'm bringing my micro brush from it's a bond brush, you see, and I'm dipping it in alcohol, like 76% or 99% alcohol. See, it's wet now, and I clean my chamber here with alcohol. In this case, you will have a very clean field and very clean chamber here. You see that? And after that, you can dry with 3-way syringe or dry with cotton pallet here. You can do whatever you want. But see now, I have very clean field. I'm very happy with my obturation. We can see from another aspect here how it's filled well and clean. And as I told you, it's a 3D obturated canal from all aspects here, as you can see. So I hope you liked my demonstration. Now I will flip the camera and I will take your questions. So don't go. Stay with me. Hello, everybody. I'm with you, and I can take your questions now. Okay, I will go up, and we'll start taking your questions. Thank you everyone who's thanking me. Yes, this live will not be saved. Maybe will last for 1 hour and then we will delete it, because the people who gave us the time, they deserve okay. Thank you. I have a lot of thanks here, so thank you all. Okay. Where's the question? How to avoid having voids after obturation? Dr. Dima, I think I answered your question. You have to fill it incrementally. So when you are using the backfill device, try to fill the canal incrementally, not one shot, and make good condensation with your cold plugger. Okay? Do not make, some people, they are going and make condensation with their heat delivery device. No need to make that. Make condensation cold compaction, okay? Not heated compaction. What do you prefer, 06 or Dr. Adima, about tapering? For me, I recommend to prepare all canals, any tooth, all canals up to taper 6, 25 or taper 6, unless we have very small canals, so or thin canals. So I prefer to go and take a taper 4. The Guttaperk after removal is wet canal. How sterilize when I use it again? Okay, a nice question. If you want to sterilize or to clean, we can't say sterilize your cone, but somehow to make it clean and somehow germs free, you can dip it in sodium hypochlorite. So for me, after I removing the cone from the canal, I put it in, I soak it in sodium hypochlorite dish, and I will take it again and obturate. So for me, I'm using sodium hypochlorite to clean my cones and somehow sterilize them. As I told you, we will not save this video. Some people asking to save it, but we cannot save it. We cannot save it, yes. How do you know that it's true tugback or false tugback? Dr. Rida, I think that I answered this question. Because of that, we are always using larger taper. Some people will ask me, why you not take taper 2? Because in taper 2, you will always have true tugback, and because the small taper, always your tugback will be apically. Okay, I can agree with you in this point, but I will disagree with you of using taper 2 because you will not have how I can say that. I have a article. I read an article about that we have to know how we gain our tugback, because we have to know the occupied area, the guttapercha occupied in the canal. So taper 2 will occupy the small area, but taper 4 will occupy more area apically. So that will be good for me. The second reason, if you will put taper 2 and you will downpack it, maybe the guttapercha will not expand in the apical area well, because the small amount of the guttapercha left in the tip. So taper 4, it's more large, so it will be expand under pressure, under the hot pressure. So taper 4 is a very good choice for us. How to differentiate between true? I answered this question. Yes, 3504. I used here in this case here 3504, not 30. Why we make the canal wet when we are fitting our guttapercha? Because we, as I say in the demonstration, first option to mimic the sealer situation, or to mimic that the canal have sealer. The second option that to keep my canal clean as much as I can, and do not pull out any debris or any periapical exudate or periapical liquids to my canal back. And another thing here I want to add, when you are drying your canals with the paper point, always respect your working length. Do not just put your paper point cone where it will stop, and dry the canal like that. In this situation, you are drying the periapical area if you have large apex. So please, always, you have to make sure that your canal is dry, not the periapical area is dry, okay? You are working just in the canal, not out the canal. What's the purpose behind clipping the end of the cone? Sometimes you have tugback, but you need it more strong. You can clip like 0.5 or 1 millimeter from the cone, and you will have a better tugback. If we try the cone, Sunrise asking, if we try the cone and we like the tugback, but we cut it, I mean, what's the purpose of cutting cone? I think that I answered you. Okay, if you are taking X-ray and your cone, it's 100% on the radiographic apex, and radiographically the apex and the canal are even, I recommend here to cut like 1 millimeter or 0.5 millimeter from the cone, because you know when you are compacting the guttapercha will expand somehow. Because of that, always I recommend you when you are preparing with your last file, you have to be precise, not to open the apex more, because over preparation and over let's say expanding the apex is not good for you. How do you manage the cut of gutta-perca 3 to 5 millimeters far from the apex in curved canals prepared with the reduced taper? Dr. Enrico Casai, I can't get your question. Well, how you manage the cut of gutta-perca? If you, I have, okay, I think I answered this question in my demo. Dr. Enrico, if you have curved canal, you have to cut up to the curve, okay? Some people can go and cut more by pre-curving. You can pre-curve sometimes the fast pack tip and try to go far with your curve, but I don't recommend this. So in this situation, you have to cut up to the curve. Unless you have good experience and you have good trust to your instruments, and you can go with your down pack instrument and cut it more epically. Dr. Minah Mustafa, dear teeth, please leave the live. This is Ivy. I have to answer this question. Okay. Why is it that sometimes that last file, example 25 taper 4, does not reach full working length despite having no ledge or clockage dentine chips, and how to overcome? Okay, Dr. Anoha, this is very good question. In this situation, you have to go back to your number 10 file and make recapitulation and be sure about your patency and irrigate more and more and more and more, and go like a step back. Take your 1504 instrument or 1506 instrument and try to make like redo of the canal preparation. Okay, re-prepare the canal. But in this, you say that you don't have any dentine chips or something else, but I think I'm sure that you have enough debris in the canal. So you have to re-irrigate, you have to recapitulate, you have to activate the irrigation to remove all the remnants from the canal and remove all debris from the canal and dentin chips. Respected, isn't the original toxic to periapical tissues? I will not argue now about the sealer, which sealer is better, literatures, what the literature say, but we just here explaining the technique, not the materials. So you can use whatever you're comfortable with. Resin-based, bioceramic sealer, whatever you want. It's up to you. How can we measure the size of the apex we prepared in order to have exactly the most suitable master cone, then a good obturation without overfilling? How to measure the apex preparation? This is a very good question. I will give you here a small information. I told you that not all cones, they are even in the canal, in the tip size. So you have a special clippers. I don't know if I can show you here. I have one from... Okay, it's like a small device. You can cut the size, so you can cut any gutta-perca cone to any tip size you want, and with that you can measure how much you prepare the canal. Otherwise, you have just to make try. You might, sometimes I'm making like two to three X-ray just for confit. It's not wrong. That's totally right, because tugback is a big issue. It's not a small detail. It's a very big detail. Tugback, it's not at all small detail. We always have, especially the people who start working with the one vertical compaction devices with lack of information about, or lack experience about how to use them. So they are always, they have a very high predispositions to make overextending. The guttapercha will be overextended. So tugback is a big issue. Could you please register the live? Okay. Yes, Dr. Jasprit here say, wow, the way guttapercha come out and sealed apical third with fast pack was a treat to the eye. Yes, you are always happy with this result. I recommend you always, if you want to shift to the warm vertical compaction technique, to start training extraorally. Do not go and start doing people RCTs, warm vertical compactions with no information or without experience. You have to take courses or see demos, make extraoral demonstrations, and then you can shift and go to treat people with warm vertical compaction or fill canals with warm vertical compaction. Okay. What do you think about nickel titanium pluggers? Yes. For example, here I have this plugger from Fanta. Have two tips. One stainless steel, and the other one is nickel titanium. See, you can bend it. Okay. Of course, you can use it if you have good experience. Why not? Hope you have tried your hands. Fast fill, okay. It's question reply. Yes, we have here a question about fitting the plugger before. Okay, of course. It's better to fit your plugger because we have different sizes. For example, this stainless steel tip, it's 75 size, 75 size. So always you have to fit everything before you are using, to avoid any surprises. Is the guttapercha bar cost effective? How much does it cost? No, it's yes, it's cost effective and good. For example, this box with 100, I think 100 pieces here. Yes, 100 bars. You can see 100 bars here. It's approximately $35 in Jordan. So it's cost effective. It's not expensive at all. I like the fast fill device because it gives sound during injection, the guttapercha, and you can mimic the amount of injection. Of course, that's a very nice thing in the fast fill device. Thank you for adding. Thank you all. When do we apply the sealer? After drying the canal and we are ready for obturation. In that moment, we are applying the sealer. Thank you all. I have a lot of thanks. Because of that, I'm repeating my thanks to you. Why don't you use 2 steps down pack? I don't like it. I don't recommend it. It's why to make 2 steps if you can make just 1 step? It's up to you. شكرا دكتور. I have here an Arabic comment. Thank you very much. Thank you دكتورة تقى القضاة. شكرا دكتورة. Thank you very much. Thank you all. Bless you all. Thank you all. I need the questions. I need the questions. Okay, you have made this demo on the largest canal. I think it will be harder on smaller canal. Oh, no. Dr. Wissam Sami, no, not at all. The technique is the same in narrow canals and large canals. You may just go and take the smaller size of the fastback tip. Otherwise, because you are prepared up to 24 or 25 or 4 or 25 or 6. So it's not about the canal size, but maybe here the tips will be different, the pluggers will be different, okay, but the technique remains the same. Thank you for a nice demonstration. Thank you too. Can you please tell me amount of sealer needed to be used with gutta percha? I told you, doctor, just take your cone and you have to see your cone through the sealer. So if the sealer is hiding your cone, that means that you are putting a lot of sealer on your cone. So you have to reduce the amount. What about sealer? Do you prefer zinc oxide original, resin based, or what? Okay. Nowadays, I'm using zinc oxide original because it's widely used now, and a lot of literature, let's say, protecting this this sealer. But for example, I worked 5 years with resin-based sealer, and I have very good cases. I had very good follow-ups. So it's up to you, Dr. Farah. You can use whatever you want. Maybe some other people can talk about sealer better than me. It's not my field. Dear doctor, can you just repeat how you get the tugback? I will give you some tips. First, use less taper of your last file. So if, for example, if you used 2506, you have to take 2504 gutta percha cone. Check with your X-ray. Do not use large taper gutta percha because you may have tugback with fit cone, but this tugback is wrong, and this is very important thing here to notice. That, for example, you see I fit my my 3006 cone in the canal, and that was not fit, but I had a very good tugback. The problem here, if I will put my 3006 cone in the canal and I will get tugback, and on X-ray I will have a very nice apical X-ray. Here I have to rethink again and make recalculations, because having tugback and having a good X-ray, it's not always enough. So that when you are using less taper, you will be more sure. I will not say that you will be 100% sure that you have very good 100% true tugback, but you will have a percentage up to 90% that you have apical good tugback. And your training and making cases more and more and more, that will give you good experience about tugback. There is danger of irrigating the periodontium due to the temperature used when cutting the... irritating, okay. Okay, of course, there's a very big danger here if you are... I told you that fast pack have very good feature that gives you just 5 seconds to make the mission. If you want to reheat again, you have to take another 5 seconds. Because of that, some devices, they have no limit. You can press for 5 minutes and you will burn the patient and you will burn the bone. Nobody will notice that. So timing here is very important, and training here is very important, not to exceed the time. Dear Ivy, if you're watching me and want me to interrupt the live, I can just write to me on the WhatsApp, because I am very excited with the people. I'm answering the questions, but I can interrupt it whenever you want. Okay, I have XM presented. Is the sealer affect the gutta perca during condensation? What do you mean by that, Dr. Sajjad? I can't get your question well, I think. You can rephrase your question and give it me again. Could you recommend a good set of plugger for plugging gutta perca with which could be internationally available, including India? Okay. What you recommend apical prep with molars apart from theoretical preparation? For example, for me, I recommend always 25 tip size files, because you know we are making mechanical preparation and we making chemical preparation. Mechanical preparation by our files, by our irrigating activators, by our hardware materials, or let's say metallic materials, okay? And the other side, we have to give good chance for our irrigants to make the duty, and to make good cleaning and disinfection, to use different irrigants, to take very good irrigation protocol and apply it in your cases. Very good question from Dr. Bisan Oude. She's asking about why we are not filling the canal, the entire canal, without cutting, just from the beginning to the end, just with the fast fill. Very nice question. Dr. Bisan, she's asking about what we call squirting technique. Squirting technique. It's Dr. Bisan. It's available technique. It's largely known technique, but the problem in this technique that you have to have very good experience, and the learning curve of this technique is very big. So if you want to try this technique, you have to have very good training and to know how to make it. Squirting technique is very nice technique. Why? Because you will have your custom gutta perca, let's say, impression or gutta perca fitting to the apex. Okay, because you will you will put the guttapercha, and the guttapercha will melt there, or the guttapercha will be in the liquid phase, and you will condense it. But you have to have very good control, visual control maybe. Sometimes you have to have good experience. So it's not easy. You can go and read about squirting technique in obturation. Very nice question from Dr. Abisan. Is it better to cut, let's say, 1 millimeter of the... Yes, Dr. Ahmed here, he's asking, for example, for me, 3004 was good with the weak tugback. Why I did not modify the tip size? Okay, you can do that. Of course, you can do that, and that's not wrong at all. That's very good question too from Dr. Wei Jian. He's asking here. It's somehow this question is like Dr. Abisan question about squirting technique. He says, how can I obturate a C-shaped canal, for example, or irregular canals like oval canals with that? Okay, I will give you the question here, the answer here. Always, we are lucky that we have always apical construction, and this apical construction what we need to gain our tugback. So if you can go and put your cone and cut it there and make apical plug with the guttapercha, so you are free to fill the entire canal with melted guttapercha, with the hot guttapercha. So the technique remains the same, because you will put small amount, compact, even if it's oval or C-shaped, it's the same. It's like you are pressing, ice cream. Okay, it's like ice cream when you are pressing the guttapercha, and you can put it wherever you want and compact it. So it's easy. For me, it's always interesting for me to deal with big canals with guttapercha, because when I fill it under microscope, I see how I can fill it properly and condensate it freely. For example, obturating large canals with this device is really amazing. I don't know how people can obturate C-shaped canals with lateral compaction. People, you have now to think to shift to the one vertical compaction. Cost effective. It's not at all expensive device, affordable. Why not to shift? Sealer of recommendation, I recommend if you want to take zinc oxide eugenol, you can try Action. It's very good from Action. They have good zinc oxide eugenol sealer. Dr. Amani asking about if I'm using bioceramic sealer. If you are using bioceramic sealer, I don't recommend you to use with it one vertical compaction technique. You can go just with single cone or multiple cone with the bioceramic sealer, and that's enough. We had a very nice lecture with Dr. Talal Nahlawi about a couple days ago. He was talking about bioceramic sealers and how can you use it, how can you inject it and put cones inside. So I don't recommend. Why? Because bioceramic sealer, when you are heating it, it will be set and it will be like a stone immediately. So we do not recommend. There's some techniques how to use one vertical compaction with bioceramic sealer, but as I told you, it's a technique. So you have to have good experience about it. You have to go apically in less than 3 seconds. So it's technique. I forget. It's who's the doctor? he have an article about this technique, but so far I don't recommend you to use warm vertical compaction when are using bioceramic sealers. Thank you, Dr. Muhannad Takturi. How to make sure the tugback is apical? I told you, I will not repeat the answer again here because I have a lot of questions. I have a lot of questions. Maybe I will give you more like 15 minutes and I will shut it down. Okay, do you try use chlorhexidine for disinfection the good? Yeah, of course, you can use chlorhexidine or just dip or soak your cone in chlorhexidine, or you can soak it in sodium hypochlorite, like 5 or 6%. It's the same. Depends what you prefer. But details always here. You know, if you are mixing chlorhexidine with sodium hypochlorite, we will have like interaction, and we will gain this brownish color, and that will seal our tubules. So you have to be sure that final irrigant in your canal was normal saline or EDTA, not sodium hypochlorite. Even you dried the canal, and your last irrigant was sodium hypochlorite, and then you are dipping your or soaking your cone in chlorhexidine, and then you are taking sealer and go in the canal, you will make micro reaction in the canal, and the parachloroalanine will be reproduced there and seal your tubules, and will not allow sealer to go in the tubules and close the lateral canal. So it's a small detail, but you have to think about it. Think about chemistry before you make this step. I hope you got my point. It's material interaction. How can we avoid sticking between guttapercha and the plugger? I think Dr. Dua Halima here she's asking about some time when she go out with the fast pack, the guttapercha will go out with her. Okay, it's a common problem. The cause of this, the causes, we have a lot of causes. First, you don't have good tugback. Second, you are trying to pull out your plugger, your heated plugger, I mean fast pack in this case, in cold position. So you have to heat it and pull it out. And you have to have very good tugback. Thanks, but I didn't see the lecture from the beginning. I think Ivy will leave the broadcast for 2 hours later, so you can check it before we are deleting it. When using bioceramic sealer, some doctors are afraid of high temperature. Of course, if you are asking about using bioceramic sealer, Dr. Tien Vu, and warm vertical compaction, I do not recommend. What is the maximum heat that I can safely use? You can use up to 250, but if you want to be in the safe side, because not all our hands are equal, not all our techniques are equal, so you can go and take 200, that's enough. Less temperature will not cut for you well. You will not feel the efficiency of cutting. So I recommend 200 degrees. If you increase your temperature, you have to decrease your time. If you will increase the temperature, you have to decrease the time. So not 5 seconds. maybe 2 or 3 seconds. So you have to reach your target in less than 3 seconds. After sterilizing cone, waiting for drying, or we dry it by the air. You can dry it by the air, yes. You can dry it by the air. Can the alcohol affect the adhesion? What do you mean about adhesion? You mean filling adhesion to the tooth, or in the canal? The question is not clear for me. Can we use 90% alcohol to disinfect gutta perca? I have here sodium hypochlorite takes time to disinfect. Okay, what's the problem with alcohol? Alcohol makes the cone very tough, very dry, so it will break easily. So do not use alcohol. I don't recommend. But if you have literature supporting that, you can use it, of course. But for me, I don't prefer to use alcohol because it will affect it negatively. Can we use combined warm vertical compaction and hydraulic condensation with gutta perca and bioceramic sealer? Means can temperature of down pack with will alter the property of bioceramic sealer? Yes. I answered this questions maybe 2 times. I do not recommend to use bioceramic sealers with heat. I do not recommend that. If you want to use it, you have to read more about that because there's some particular details. Will there be any discrepancy in the filling? Discrepancy in filling C-shaped canals? No, there's no difference. The technique remains the same. If we fill the root and we have short O3 to O5, it's not that big issue, but you have to know that the O3 or O5 are patent and they are clean and you have patency before, okay? So O3 to O5, it's not that big or not a large distance, let's say. It's safe. So you are fine, I think, because when you are pushing, you may fill this O3 or this or O5 because the gutta perca will expand. What if we have 2 apex for the same canal? How can we compact the apex by one vertical method? Very nice question, Dr. Rashid. Dr. Rashid here, he is asking here about the delta. If we have delta in the apex, in the apical area, and the 2 orifices or 2 let's say exits are big, and you have visual control, and you have, let's say, because sometimes in a straight canal you can have visual control under microscope, but if you don't have microscope, you have from the beginning to decide which canal is the major canal for you, and you will prepare to the end. And if you can go and prepare the other canal, do it. And in this case, if you have good experience with MTA, I prefer for you to make MTA plug for for the delta, to fill the delta with MTA or with bioceramic sealer. Bioceramic sealer here will make good job. But if you are using gutta perca and you don't have visual control and the canal is curved, let's say, and the canal it's narrow, it's not a very big canal I can't put 2 cones. So you can go and obturate the first one and cut it up to the bifurcation area, and then go out and put another cone. But you have to know that you have prepared the both canals, the both endings, the both exits. If the other exit is just like lateral canal, let the sealer do the job. Though any sealer can do the job, and I think it's good. Why you use zinc oxide original, don't use bioceramic sealer? Because here I am demonstrating one vertical compaction technique. If I am demonstrating bioceramic sealer, I will do it in less than 1 minute. Dr. Yusuf Jitawi asking, Dr. Muhannad, thank you first. Thank you very much. If sodium hypochlorite come in contact with the sealer, and it will affect its activity because the difference in the acidity. Okay, but you have to dry your canal well. Of course, you will not guarantee that the canal is dry 100%, but you are putting your cone and go out there and the cone is dry. If there is any sodium hypochlorite penetrating in the tubules maybe or in the walls, I don't think so that will affect it negatively or in high percent. Why start with cones epically, not obturation system? It's about squirting technique, but somehow different question. I will not answer because I answered it. Okay, I will go down with this question because I have a lot of questions. So please, sorry for, I will not answer all questions, a lot of questions. I think I can sit here for 4 hours answering. Can we use, Dr. Zahra Al-Baylasan, can we use gutta-perca taper 4 if end preparation? Of course. In my case, I prepared up to taper 6 and I obturated with taper 4, and this is the clue here. This is the trick here. How to fill open apex canal without going beyond the working length? Very nice question. Very nice question. If you have open apex or large prepared apex, let's say, maybe you prepared it accidentally and it's very large now, you can make MTA plug. So you can plug the apical third with MTA, and the rest you can go and use your fast fill or your backfill gutta-perca gun and fill it up. Okay. A lot of the questions, they are repeated. Some endodontists change the protocol of continuous wave when used bioceramic sealer not to reach 5 millimeters of the apex in the heat carrier. Is this scientifically supported? I told you, Dr. Aida, there's, I forget the name of the doctor, but there's a technique how to make one vertical compaction with bioceramic, but it's not clear yet. I do not recommend it. Why to use one vertical compaction and you are using bioceramic sealer? Why? So do not make an extra headache and thinking about that. People, about irrigation. Here we have a question from Dr. Salma Omar. She's asking, should we wet the canal with normal saline before putting the sealer? Okay. I don't have problem with which irrigant you finished up. You finished up with EDTA, you finished up with sodium hypochlorite, you finished up with normal saline, you finished up with any other irrigant. The most important thing here for me, that you irrigated well, that you irrigated the canal according to protocol, activating the irrigants. You used the right way of irrigation, the right amount, the right time. Whatever you will end with, sodium hypochlorite, with with DTA, EDTA, whatever you want. It's not a problem at all. But some doctors, they say finish up with. They are saying to finish up with normal saline to remove the sodium hypochlorite from the lateral canals, or to clean the walls well because of interaction of sealer and sodium hypochlorite. So It's not a big issue. I don't think it's a big issue. I will go down. I will try to. Okay. We have more and more questions. Thank you, everybody. I am very happy that you enjoyed my lecture or my demonstration. We tried to make it this time demonstration with the 80th company because maybe you are somehow bored with slides and literature studies, and here we are going live and doing that in front of you with all mistakes, with unexpected issues could happen with us. So I think that live demonstration is the most important thing. For example, for me, when I am attending any course, this course don't have live demonstration, I will rethink again, because live demonstration from the lecturer or from the speaker is very nice, because you will trust it, you will trust him more, you will respect him more, you will see how he's moving his hands. For that, I'm preparing a lecture just about manual skills, how you can improve your manual skills in dentistry and out of dentistry. Because of that, always the live demonstration, it's like shooting film and at the same time monitoring it for people. You will see all mistakes, you will see all aspects. So because of that, I could, for example, go and make a video for like 15 minutes and put it in my slides and showing it up for you. But live demonstration will stick here in the mind and you will be able to understand it better. Okay, we have here a question. Irrigation protocol. How long must I activate the irrigation? How much cc sodium hypochlorite? Okay, people, many colleagues are always asking about quantity, time, how long, how often. I don't think it's the right question. The right question is how, not how long, not how much. It's how to make it. For example, if you have multi-rooted, let's say, tooth, or multi-canaled tooth, you have always here time to make irrigation. Why? Because when you are working with one canal, you are leaving the irrigation in the other canal, and so on. But when you are working with a single-rooted tooth or single canal tooth, here the problem, because you can finish your preparation in less than 2 minutes. And what I want to do now, I will go and make obturation. No, of course you have to give the irrigation time to work, because you know sodium hypochlorite as a major irrigant besides chlorhexidine and EDTA needs time to let's say to dissolve and clean. So you have to give him the time. And fortunately now we have this ultrasonic activators, like from AT, they have Ultra X. You can put and activate your irrigation, so you will enhance the irrigation process and make it maybe better, and you can reduce somehow the time, because when you are activating your irrigation, you are making like a storm inside, so you will reduce the time for irrigation somehow. I will not say always. So it's not matter of it's a matter of not only time and amount, it's technique and a case. So it's individual. It's you can take it individually. we use sodium hypochlorite solution for irrigation when then after it, so we have to use EDTA solution every time or not. The good thing about sodium hypochlorite, it's a very cheap and good irrigant and so on, and it's the efficiency, it's very good. But the problem of sodium hypochlorite that you cannot deal with the smear layer only with sodium hypochlorite. Has a very small effectiveness on the smear layer. Because of that, we can go and use EDTA, because EDTA will make the tubules very clean if you will go and cut the tooth out and make slides and see this under electronic microscopes. If you are using EDTA, you will have good treatment, or you will have good effect on the smear layer. So EDTA is good to use it special in the last before obturation. I recommend it. What about cutting little millimeters from master cone? Okay, you can, of course, you can do that. Is the moderator online? I don't know why you are asking this question. You can ask me why you are asking about that. Okay, people, let's take some last questions. Okay. The other questions are repeated. Here I have a question about curved canals and how I can deal with curved canals. If you are asking about obturation of curved canal, I answered this question. But if you are asking how to deal it in preparation and irrigation, it's a little bit a different question. We can answer it in maybe another lecture about managing of curved canals, but I can't give you all hints and tips now quickly. It's dangerous to give a huge amount of informations quickly, because you will misuse this information maybe. What do you think of manual activation? It's good, but what's better? I want to ask you, Dr. Abdo. You can go to your home on your feet, or you can use car. Of course, car is quickly better, faster, time effective. So why to use something manual if you have something ultrasonic? You know, ultrasonic is very quickly, it's very good, it's very safe. So okay, manual activation is good, but why? But it will not do the same job at all. So I recommend sonic or ultrasonic. Cost-effective device, good device, you can use it. You can just, from ETIR, this Ultra X I told you about, I can show you the device. This is the Ultra X. This is Ultra X device. See, it's wireless device, good device, cost-effective device. You can manage curved canal with this device in irrigation aspect. I mean, you can manage fracture instruments, you can cleaning isthmus, This device is amazing. When they just make this device, they told us it's just for irrigation. But now we are using this device for broken instruments. We are using this for file activation. I use this device, amazing device. I can use it to remove guttapercha from the walls. So it's a universal device for me. Okay, people, I have to go now. Thank you for your questions. Maybe we will go live later and talk about your questions and answer your question more and more. We are live with you for more than 90 minutes, 1.5 hours. I was very excited with you. I'm thanking Evie for this opportunity to be live with you. I hope you liked my demonstration. Stay safe, stay home. You see what is happening now with COVID-19. So now you are a hero when you are sitting in your home. So please sit in your house with your kids, with your family. Do not go out. You are helping others by sitting home and watching our lectures. With 8 Teeth, we have just like our page here in 8 Teeth, and you can always check our lectures. 8 Teeth have more and more lectures tomorrow, after tomorrow, every day. We have good schedule. We have very good speakers. Maybe you watched other lectures in our page. So please stay home. Keep learning even you are sitting home. It's your chance now. It's your opportunity now to make, because you have good time now. Always, we are dentists. As a dentist, our big problem here, it's time. We have no time. We have no time. We are not calling each other because we have no time. We are not playing with our kids because we have no time. Now you have time. You have time to learn. You have time to read. You have time to maintain your house. Sorry, you have time to maintain your house or something broken in your house. So stay safe, people. Love you all. Thank you for your questions. I'm sorry if I couldn't answer all questions. I'm sorry for that. Hope to see you soon with other lectures. Today I will be live at 8:15 Jordan time, talking about ledge management, but not here, not on 8 Teeth. Check my account. Thank you very much. See you soon. Goodbye. Stay safe. Love you all.